Free CNA practice test with answers 180 questions, 2026. Question 1. The nursing assistant knows that the responsibilities of the position do not include A. Helping a resident to bathe, B. Administering a medication, C. Keeping a resident's room tidy, D. Applying an ice pack as ordered. The correct answer is administering a medication. Nursing assistants may not administer medications, it is not within their scope of practice. Only RNs, LPNs, and other properly licensed personnel may give medications. Question 2. Which of the following would be considered an example of battery toward a patient? A. The nursing assistant cleans the resident's glasses. B. The nursing assistant asks for permission before touching the resident to assist them to the bathroom. C. The nursing assistant bathes the resident without his or her permission. D. The nursing assistant keeps a resident isolated from others as a form of punishment. The correct answer is the nursing assistant bathes the resident without his or her permission. Bathing a resident without his or her permission is an example of battery. Keeping a resident isolated from others as a form of punishment is an example of involuntary seclusion. Question 3. The nursing assistant suspects that a resident in the facility is being abused due to multiple unexplained bruises, refusal to answer most questions, and refusal of ADLS. Which of the following actions should the nursing assistant take next? A. Notify the nurse assigned to care for the patient about the bruises. B. Report the suspected situation to the nursing assistant's immediate supervisor. C. Task the resident repeatedly to identify an abuser. D. Wait for more proof in order to identify the abuser. The correct answer is report the suspected situation to the nursing assistant's immediate supervisor. Abuse in nursing facilities, or even suspicion of abuse, should be reported immediately to the nursing assistant's supervisor. This requires more intervention than the nursing assistant's scope of practice covers. Question 4. MRSA is an example of which of the following? A. A resistant strain of bacteria that is difficult to treat with antibiotics. B. A bacterial strain that is easy to treat with antibiotics. C. A mnemonic to remember how to act if there is a fire in the facility. D. A set of activity guidelines designed to keep residents safe. The correct answer is a resistant strain of bacteria that is difficult to treat with antibiotics. MRSA stands for methicillin-resistant Staphylococcus aureus and is very resistant to most antibiotic treatments. Question 5. What is the best way for a nursing assistant to prevent infection? A. Use standard precautions when caring for residents. B. Apply an antiseptic hand rub before and after caring for residents. C. Wear gloves when in contact with body fluids. D. Frequent hand washing. The correct answer is frequent hand washing. Frequent hand washing is the best way to prevent infection without a doubt. The other measures are supportive. Question 6. Which of the following is a key part of care when administering a bath to a resident? A. Clean the perineal area of a patient before assisting them to clean their face. B. Use cool water when bathing the patient to promote better circulation. C. Allow participation in care to promote a sense of independence. D. Perform all care for the resident in order to conserve their energy. The correct answer is allow participation in care to promote a sense of independence. Allowing the resident to participate in care will raise their self-esteem and allow autonomy. It is inappropriate to clean the perineal area before the face, or to use cool water rather than comfortably warm water. Question 7. A nursing assistant cares for a resident. Which of the following skin care measures are correct? A. The nursing assistant does not begin perineal care until a second staff member is present. B. The nursing assistant notes an unblinchable red area on the resident's sacrum and reports it to the nurse. C. The nursing assistant applies talcum powder beneath the abdominal folds of the resident. D. The nursing assistant applies a prescription ointment as ordered. The correct answer is the nursing assistant notes an unblinchable red area on the resident's sacrum and reports it to the nurse. It is the duty of the nursing assistant to report any red pressure spots on the resident to the nurse. The nursing assistant may not apply any prescription ointments. Question 8. Before shaving a resident, the nursing assistant checks for which of the following items in the resident's care plan? A. Shaving instructions related to problems or issues clotting. B. History of a heart condition. C. A presence of the resident's razor from home. D. Any previous refusal of ADLS. The correct answer is shaving instructions related to problems or issues clotting. It is necessary to check the shaving instructions in the resident's plan of care to be aware of any problems clotting and the necessity of using an electric razor as opposed to a traditional one. Question 9. Fecal impaction may present with which of the following symptoms? A. Dark urine. B. Excessive flatulence. C. A small, watery leakage of stool. D. Abdominal pain. The correct answer is small, watery leakage of stool. The watery leakage of stool around a blockage is the most specific sign of fecal impaction, also known as a bowel obstruction. Question 10. Dyspnea is a term that refers to difficulty with which of the following? A. Urinating. B. A breathing. C. A defecating. D. Swallowing. The correct answer is breathing. Dyspnea is a term that refers to difficulty with breathing. Question 11. Which of the following statements is true about Alzheimer's residents? A. An increased appetite is common as Alzheimer's progresses. B. A residents can never be reoriented because they will immediately forget it. C. The resident may become confused, but hallucinations are never a part of Alzheimer's. D. It is important to maintain a routine to avoid confusion and overstimulation. The correct answer is it is important to maintain a routine to avoid confusion and overstimulation. Maintaining a routine is incredibly important to Alzheimer's patients. Hallucinations and a decrease in appetite are common. It is important to frequently reorient the patient. Question 12. Which of the following is a correct aspect of making an occupied bed? A. Place soiled linen on the floor until the bed has been remade with clean sheets. B. Mitering the corners of the new sheet is no longer recommended. C. Lower the bed to the lowest level when the procedure is complete. D. Avoid raising the bed rails unless absolutely necessary. The correct answer is lower the bed to the lowest level when the procedure is complete. Lowering the bed to the lowest level is important for safety. Mitering the corners of sheets is recommended, as is raising side rails. Never place soiled linens on the floor. Question 13. Which of the following is an example of a pulse rate that should be reported to the nurse? A. 45. B. 82. C. 64. D. 98. The correct answer is 45. Any pulse outside the range of 60 to 100 should be reported immediately to the nurse for the resident's safety. Question 14. The nursing assistant knows that signs of hypoglycemia include which of the following? A. Tachycardia. B. Hot and dry skin. C. Polyuria. D. Sweating. The correct answer is sweating. Sweating, as well as confusion and tremors, are signs of hypoglycemia. Question 15. Which of the following guidelines regarding residents who are hard of hearing would be considered correct? A. Encourage family participation to make sure they understand you. B. Speak clearly and slowly as you face the resident. C. Write down words rather than speaking. D. Speak in a high-pitched voice to enhance understanding. The correct answer is speak clearly and slowly as you face the resident. Speaking clearly and slowly while facing the resident helps with lip reading and comprehension. Question 16. A resident is ordered to be in high Fowler position for each meal. Which of the following descriptions is the most accurate depiction of high Fowler position? A. The patient lies on their stomach for 20 minutes prior to eating. B. The patient's bed is at a 60-degree angle with the feet propped up. C. The patient's bed is at a 30-degree angle with the patient slightly slumped over to the left. D. The patient's bed is at a 90-degree angle and the patient is positioned sitting up. The correct answer is the patient's bed is at a 90-degree angle and the patient is positioned sitting up. High Fowler's is a description of the patient sitting straight up in bed, meaning the bed itself has to be at a 90-degree angle to support them. Question 17. What protective equipment should be worn when changing an incontinent patient? A. Gloves, gown, and a mask. B. Mask and gown. C. N95 mask. D. Gloves and gown. The correct answer is gloves and gown. The nursing assistant should wear a gown and gloves at most as correct contact precautions. Question 18. Of the following symptoms, which one is most likely due to an infection in a resident? A. Pale skin. B. Sudden onset confusion. C. Tinted skin. D. Aphasia. The correct answer is sudden onset confusion. Infection, especially in older clients, tends to cause sudden onset confusion. Tinted skin may be normal for an older client, as could pale skin. Question 19. The nursing assistant knows that the term NPO means A. Bed rest only. B. No oral temperatures are to be taken. C. Liquid diet. D. Nothing by mouth. The correct answer is nothing by mouth. NPO is a Latin abbreviation that stands for nil per os or nothing by mouth. It indicates that the client is not allowed food, fluids, or oral medications. Question 20. The nursing assistant should tell the nurse if the client with diabetes A. does not touch their lunch tray, B. decides not to finalize a will, C. reports numbness in their feet sometimes, D. combs their hair without being prompted. The correct answer is does not touch their lunch tray. Someone with diabetes should always eat regular meals to keep their blood sugar relatively stable. Numbness in the feet is neuropathy, a common side effect of diabetes. Question 21. The nursing assistant knows that residents on bed rest must be turned every A. 6 hours, B. 8 hours, C. 1 hour, D. 2 hours. The correct answer is 2 hours. Residents on bed rest must be turned every 2 hours to maintain skin integrity. Question 22. Which of the following pulses will be most commonly used by a nursing assistant when acquiring vital signs? A. Popliteal. B. Radial. C. Brachial. D. Femoral. The correct answer is radial. The radial pulse is the most easily accessible location to take a pulse. Question 23. The nursing assistant is helping residents to eat in the dining room when, suddenly, a resident stands from their seat and begins clutching their throat while coughing silently. The nursing assistant performs which of the following actions first? A. Ask the resident if they are choking. B. Begin CPR immediately. C. Call 911. D. Begin the Heimlich maneuver. The correct answer is ask the resident if they are choking. It is important to first assess whether or not the resident is choking. If they are able to answer, air is still moving through the trachea. Question 24. A client at the facility receives a new roommate. While the roommate is in the bathroom, the client leans toward the nurse and whispers, "Why is she here anyway? Is she sick?" The best response by the nursing assistant is, A. Why don't you ask her yourself? B. I'm afraid I can't share that information with you. C. She's here for the same thing as you. D. I'm not sure. Let me take a look at her chart. The correct answer is I'm afraid I can't share that information with you. HIPAA requires you to keep clients' health information confidential. Period. Question 25. A client with Alzheimer's wakes up more confused than usual one morning. The nursing assistant knows that, after breakfast, it is most important to support normal gastrointestinal tract function by A. Recording intake and output, B. Taking the client to the bathroom, C. Assisting the client to call family members, D. Brushing the client's teeth. The correct answer is taking the client to the bathroom. Taking the client to the bathroom will most likely prompt a bowel movement, which supports GI tract health. A confused patient may not remember what the urge means. Question 26. The client asks the nursing assistant to assist her to cut her toenails. The nursing assistant knows this client has type 2 diabetes. Which of the following actions is best? A. Check the client's blood glucose before cutting her toenails. B. Check the chart for physician orders regarding nail trimming. C. Report to the nurse that the client needs her toenails trimmed. D. Retrieve a safety clipper and hand it to the client. The correct answer is check the chart for physician orders regarding nail trimming. Diabetic clients often have special instructions regarding nail trimming. Check the chart for specific orders. Question 27. Which of the following options is the best method to prevent insomnia? A. Ensure the client eats 1 apple per day. B. Encourage the client to take several naps daily. C. Encourage the client to take several walks around the facility daily. D. Encourage the client to remain in bed throughout the day. The correct answer is encourage the client to take several walks around the facility daily. Walking and physical activity during the day promotes rest and well-being at night. Question 28. The nursing assistant takes the temperature of an elderly client and finds it to be 100.6 degrees Fahrenheit. The client reports having just taken a sip of hot tea. Which of the following actions is appropriate? A. The nursing assistant waits at least 15 minutes before retaking the temperature. B. The nursing assistant records the temperature in the chart. C. The nursing assistant scolds the client for not letting her know beforehand. D. The nursing assistant takes an axillary temperature instead. The correct answer is the nursing assistant waits at least 15 minutes before retaking the temperature. Waiting 15 minutes ensures the temperature of the mouth will be more accurate. Axillary temperatures in the elderly are often not the best measure. Question 29. A client under the nursing assistant's care suffers from chronic foot drop. The nursing assistant can expect to find which of the following devices in the client's room? A wedge. B. A mechanical lift. C. Positioning boots. D. 2 extra pillows. The correct answer is positioning boots. The boots will ensure that the feet are dorsiflexed to prevent contractures and discomfort. Question 30. A nursing assistant takes the blood pressure of a client and finds it to be 82/43. The client reports feeling dizzy. The nursing assistant should A. Take the client's pulse next. B. Report the finding to the nurse. C. Record the vital sign in the chart. D. Instruct the client to drink more fluids. The correct answer is report the finding to the nurse. It is very important to report a symptomatic low blood pressure to the nurse for further investigation. Question 31. The range of motion term abduction means A. Moving the extremity away from the body. B. Moving the extremity toward the body. C. Moving the extremity above the body. D. Moving the extremity below the body. The correct answer is moving the extremity away from the body. To abduct is to move away, to adduct is to move closer or toward. Question 32. Which of the following most addresses a client's needs in regard to spirituality? A. Ask the client why he or she is of a particular faith. B. Provide the client with warm water, soap, and towels every morning. C. Assist the client to the facility's chapel every Sunday. D. Treat any religious objects in the client's room as if they were any other. The correct answer is assist the client to the facility's chapel every Sunday. Support the client in their own individual religious needs. Treat any religious objects in their room with respect. Question 33. Proper body mechanics when lifting clients involve which of the following? A. Keep the spine curved. B. Bending at the waist. C. Bending at the knees. D. Avoid seeking assistance. The correct answer is bending at the knees. Bending at the knees is the only proper body mechanic listed. Avoid doing all the others. Question 34. Which of the following would be a primary indication of hepatitis? A. Hypertension. B. Hyperglycemia. C. Jaundice. D. Hypotension. The correct answer is jaundice. Jaundice, also known as yellowing of the skin, occurs frequently in cases of hepatitis, liver disease. Question 35. Which of the following aspects of care is important for a confused client? A. Checking the client's blood sugar every hour. B. Tasking the client their name. C. Keeping the client contained in their room. D. Reorienting the client frequently with clocks, calendars, and family mementos. The correct answer is reorienting the client frequently with clocks, calendars, and family mementos. Reorienting the patient frequently is the most important aspect of care. Keeping the client locked in their room could agitate them. Question 36. What type of client may opt to receive hospice care? A. Client with kidney disease. B. Client with cancer. C. Terminally ill client. D. Client with diabetes. The correct answer is terminally ill client. Terminally ill clients may receive hospice care, which is designed to relieve pain rather than to cure disease. Question 37. Cheyne-Stokes respirations occur in a client who A. has a history of chronic respiratory issues, B. is unconscious, C. is recovering from an asthma attack, D. is close to death. The correct answer is close to death. Cheyne-Stokes respirations are a breathing pattern marked by increased respirations, labored breathing, and periods of apnea. It is important to report these signs if discovered in a resident who is not expected to show them. Question 38. A client in the day room is having a panic attack. The nursing assistant should A. tell the client to breathe as slowly and deeply as possible. B. have the client talk about the panic attack. C. encourage the client to verbalize their feelings. D. ask the client about the cause of the panic attack. The correct answer is tell the client to breathe as slowly and deeply as possible. During a panic attack, the nursing assistant should make the client comfortable and encourage them to breathe slowly and deeply. Question 39. Which of the following residents is demonstrating orthopneic position? A. The resident sits in a chair with their back straight. B. The resident sits on the side of the bed and leans forward over a bedside table. C. The resident walks using a cane. D. The resident lays on their stomach with their face to the side. The correct answer is a resident sits on the side of the bed and leans forward over a bedside table. Orthopneic position is meant to assist in breathing. Leaning forward makes it easier to get air into the lungs. Question 40. A resident is choosing items for breakfast. Which of the following items contains the most amount of potassium? A. Eggs, B. Cantaloupe, C. Toast, D. Strawberries. The correct answer is cantaloupe. Cantaloupe is a melon that contains massive amounts of potassium. Other foods that contain high potassium include bananas and dark leafy greens. Question 41. When helping a client with left-sided weakness due to a CVA, the nursing assistant should position the client's cane A. in front of the client, B. on the left side, C. on the right side, D. away from the client. The correct answer is on the right side. The nursing assistant should place the cane on the side that is the strongest so that it can support the weak side. Question 42. CPR, cardiopulmonary resuscitation, should be performed when A. a client is unconscious, B. a client is choking, C. the client has no pulse and is not breathing, D. the client has a pulse but is not breathing. The correct answer is a client has no pulse and is not breathing. CPR is performed on a client that has no pulse and is not breathing. Question 43. A nursing assistant enters a client's room and finds a fire burning in a trash can. The nursing assistant's first action is to A. call the nurse for help, B. remove the patient, C. try to put out the fire, D. pull the fire alarm. The correct answer is remove the patient. The acronym RACE is used for fire situations: rescue, alarm, contain, extinguish. First, you must rescue the client to prevent harm. Question 44. Log rolling is a technique best used for which of the following patient diagnoses? A. Left tibial fracture, B. a spinal cord injury, PSI, C. cellulitis of the right arm, D. psychosis. The correct answer is spinal cord injury, PSI. A PSI patient is prone to further damage and injury to the spinal cord if the legs cross over the midline. This can be avoided with proper log rolling technique. Question 45. When a client constantly ignores the urge to void, the client is putting themselves in danger of what complication? A. Constipation. B. Incontinence. C. Insomnia. D. Poor appetite. The correct answer is incontinence. Incontinence can occur if the bladder becomes too full and is unrelieved. Question 46. Which of the following types of grief is considered a normal and healthy part of grieving? A. Anticipatory. B. Complicated. C. Unresolved. D. Inhibited. The correct answer is anticipatory. Anticipatory grief occurs before the loss actually happens and is a normal part of grieving. Question 47. A patient is on a clear liquid diet. Which of the following is not allowed on this diet? A. Water. B. TC, coffee. D. Orange juice with pulp. The correct answer is orange juice with pulp. Orange juice with pulp is not allowed. The pulp is not considered part of clear liquid. Tea, coffee, and water are all allowed. Question 48. A client with a Foley catheter is ordered to ambulate twice daily. Before ambulating the client, the nursing assistant should A. Keep the bag below the bladder level. B. Raise the bag above the bladder level. C. Have the patient cover the bag with a pillow sleeve. D. Ask the nurse to confirm this order. The correct answer is keep the bag below the bladder level. Keeping the bag below the level of the cavity ensures that bacteria cannot migrate up from the bag and up into the bladder due to gravity. Question 49. Which of the following items is necessary in order to place a patient in restraints? A. The hospital administrator's approval. B. The charge nurse's approval. C. Physical restraints. D. A physician's order. The correct answer is a physician's order. The physician needs to order restraints before they can be legally applied. No one else can ask for restraints for a patient or it is considered battery. Question 50. A client eats a bagel and one large glass of orange juice. What is the correct way to record the amount of juice? A. 480 cubic centimeters. B. 120 cubic centimeters. C. 120 milliliters. D. 480 milliliters. The correct answer is 480 milliliters. The abbreviation of cc is no longer appropriate in the medical field. Only ml should be used. A large glass is 480 milliliters. Question 51. One of the patients on the unit is on airborne precautions due to suspected tuberculosis. To rule out the disease, the doctor has ordered sputum specimens to be collected. What is the best daily time for the nursing assistant to collect the specimens? A. Before a meal. B. After a meal. C. First thing in the morning. D. Last thing before the patient goes to sleep. The correct answer is first thing in the morning. The sputum produced upon awakening is the most concentrated sputum and will yield the most accurate result. Question 52. The nursing assistant walks into a patient's room and discovers him masturbating. Which of the following actions is correct? A. Scold the patient and tell him he should be ashamed of himself. B. Exit the room to provide privacy for the patient. C. Report the activity to the nurse in charge. D. Ask the patient why he is doing this to himself. The correct answer is exit the room to provide privacy for the patient. Masturbation is a normal expression of sexual health. Attempt to exit quietly without disturbing the client in order to preserve his privacy and decency. Question 53. The nursing assistant cares for a client who is extremely agitated. She yells, screams, and frequently tries to bite staff. The nursing assistant should A. Use restraints to ensure the client's safety. B. Speak calmly in an authoritative and neutral manner to the client. C. Use the television to distract the client. D. Provide care only when absolutely necessary. The correct answer is speak calmly in an authoritative and neutral manner to the client. Speaking calmly in a neutral manner can soothe an agitated client. Restraints are not appropriate for a client who is merely confused and can be placated. Question 54. A client with a terminal illness tells the nurse that he has begun praying every night. The client states, "If I pray every night, God will forgive me." This represents which stage of grief? A. Acceptance. B. Bargaining. C. Denial. D. Anger. The correct answer is bargaining. This patient is bargaining to be forgiven in order to cure his illness. This is a normal stage in the grieving process. Question 55. Which of the following pieces of assistive equipment would be most helpful in moving an immobile client from their bed to a chair? A. Mechanical lift. B. A draw sheet. C. Gait belt. D. Wrist restraints. The correct answer is mechanical lift. A mechanical lift should be used for immobile or NWB residents. A gait belt should never be used on an immobile resident to lift them. Question 56. The nursing assistant prepares to give a patient a bed bath. Before turning the patient to rub their back, the nursing assistant notices that he has a Foley catheter in place. Where should the nursing assistant secure the catheter to ensure it is not pulled during the bath? A. To the lateral aspect of the patient's thigh. B. To the bed sheet. C. To the medial aspect of the patient's thigh. D. To the bed. The correct answer is to the lateral aspect of the patient's thigh. Securing the catheter to the lateral aspect of the patient's thigh ensures it cannot be painfully pulled during the bath. Question 57. A patient has just received news about the death of his spouse. He states to the nursing assistant, "I can't believe this has happened to me. I don't know what to do. How can I live without my wife?" The nursing assistant best responds by stating, A. You will need more time to cope with this loss. B. I understand you're in pain. I'll stay with you. C. This kind of thing will happen to everyone eventually. D. Do you and your wife have any children together? The correct answer is I understand you're in pain. I'll stay with you. This is the best answer because it reflects what the patient is feeling, pain, and stays with the patient to comfort him. Question 58. The nursing assistant helps a patient who recently had a right-sided stroke to bathe. Which of the following describes the best method to support the patient's independence? A. Allow the patient to perform as much of the bath as possible. B. Task the patient what he wants to do. C. Complete the entire bath for him to conserve his energy. D. Encourage the patient to do the best he can to clean himself. The correct answer is allow the patient to perform as much of the bath as possible. It is best for the patient to perform as much of the bath as possible, with the nursing assistant helping out when necessary. Question 59. A resident comes out of their room saying they have burned their leg after they dropped hot soup on it. The skin looks blistered and red. The nurse assistant knows this is A. Superficial burn. B. Partial thickness burn. C. Total thickness burn. D. Serious burn. The correct answer is partial thickness burn. This describes a partial thickness burn. A total thickness burn appears waxy and white, while a superficial burn might be described as blotchiness of the skin with no blistering. Question 60. A client who has not had a bowel movement in 4 days would receive the most benefit from which of the following procedures? A. Endoscopy. B. A colonoscopy. C. Catheterization. D. Enema. The correct answer is enema. An enema will help the patient in expelling fecal matter before it can become impacted. Question 61. Client with osteoarthritis may be on bed rest for prolonged period. The nursing assistant is aware that she should A. Encourage coughing and deep breathing and limit fluid intake. B. Provide only passive range of motion and decrease stimulation. C. Have the client lie as still as possible and give adequate massage. D. Turn the client every 2 hours and encourage coughing and deep breathing. The correct answer is turn the client every 2 hours and encourage coughing and deep breathing. A bedridden client needs to be turned every 2 hours, have adequate nutrition, and cough and deep breathe to prevent potential complications of pressure ulcers and pneumonia. Question 62. Justine, CNA, was instructed by the staff nurse to elevate the client cast left limb to prevent swelling. Justine is elevating the cast extremely correctly when she does which of the following? A. Places the cast limb above the level of the heart. B. Places the cast limb close to the body. C. Places the cast limb below the level of the heart. D. Places the cast limb at the level of the heart. The correct answer is places the cast limb above the level of the heart. To reduce swelling, place the cast limb above the level of the heart with the use of pillows. Question 63. A nurse obtain an order from a physician to restrain a client by using a jacket restraint and delegates a nursing assistant to assist in the restraining of the client. Which of the following observations indicates inappropriate application of the restraint by the nursing assistant? A. A safety knot in the restraint straps. B. Restraint straps that are safely secured to the side rails. C. Jacket restraint straps that do not tighten when force is applied against them. D. Jacket restraint secured so that two fingers can slide easily between the restraint and the client's skin. The correct answer is restraint straps that are safely secured to the side rails. The restraint straps should be secured to the bed frame and never to the side rail to avoid accidental injury in the event that the side rail is released. Question 64. The nurse inserts a Foley catheter to relieve a client urinary retention. Which of the following is an inappropriate action in caring for client with an indwelling catheter? A. Emptying the drainage bag every 6 to 8 hours. B. Attaching the drainage bag to the lowest part of the side rails near the client's feet. C. Keeping the drainage bag below bladder level. D. Positioning the tubing without dependent loops. The correct answer is attaching the drainage bag to the lowest part of the side rails near the client's feet. The bag hangs from the bed frame, chair, or wheelchair. It must not touch the floor. Do not hang the drainage bag on a bed rail. Question 65. Elderly patient are prone to stomachaches and bloating. Which of the following foods are avoided since they are gas-forming and contribute to the said condition? A. Prunes. B. Cauliflower. C. Colas and sodas. D. Protein-rich foods. The correct answer is cauliflower. Cauliflower is gas-forming. Other examples of gas-forming foods are beans, cabbage, radishes, and cucumbers. Question 66. In preparing a client for a hot sitz bath, the nursing assistant should check the temperature of the water. The ideal water temperature is A. Between 105 degrees Fahrenheit and 120 degrees Fahrenheit. B. Between 95 degrees Fahrenheit and 110 degrees Fahrenheit. C. Between 80 degrees Fahrenheit and 93 degrees Fahrenheit. D. Between 65 degrees Fahrenheit and 80 degrees Fahrenheit. The correct answer is between 95 degrees Fahrenheit and 110 degrees Fahrenheit. The ideal temperature of the water for a hot sitz bath is between 95 degrees Fahrenheit and 110 degrees Fahrenheit. Water that is too hot will burn the client, and water that is too cold will cause the muscles to tighten up. Question 67. The nurse has delegated the following order to you: obtain a urinary specimen to test for sugar and ketones in a client with a medical history of diabetes mellitus. You are aware that you will obtain the specimen A. at bedtime, B. 30 minutes after meals and at bedtime, C. 30 minutes before meals and at bedtime, D. before breakfast. The correct answer is 30 minutes before meals and at bedtime. To determine the presence of these substances in the urine, these tests are usually done 4 times a day, 30 minutes before meals and at bedtime. Question 68. The nurse aide was asked by the licensed nurse to change the non-sterile dressing of a client. Which of the following statements is best when pertaining to this situation? A. Tactfully refuse the delegated task because you are limited in changing dressings on your own. B. After the wound has been cleansed, apply clean dressings and tape completely around the edges of the bandage. C. In cleansing the wound, start from the surrounding skin towards the wound in longitudinal strokes. D. In changing a dressing, always note the color, odor, amount, and consistency of the drainage on the old dressing. The correct answer is in changing a dressing, always note the color, odor, amount, and consistency of the drainage on the old dressing. Dressings that do not require the use of sterile technique will often be assigned to your care. Always note drainage characteristics. Question 69. Which is correct about ostomy care? A. Bit is done under sterile technique. B. Bit needs doctor's order for changing of ostomy pouches. C. Babel clients can perform this procedure by themselves once they have been taught by the nurse. D. The client can still defecate normally. The correct answer is able clients can perform this procedure by themselves once they have been taught by the nurse. Ostomy care is done aseptically, rules of cleanliness. It does not require a doctor's order for changing the ostomy pouch. Question 70. A client has a deep vein thrombosis, DVT, and has orders by the doctor to apply elastic stockings. The nursing assistant is correct in performing this when she A. applies the stockings while the client is on bed. B. Applies the stockings while the client is sitting on the chair. C. Applies the stockings while the client is sitting on the bed and dangles her feet. D. Applies the stockings while the client is standing. The correct answer is applies the stockings while the client is on bed. Elastic stockings or anti-embolic stockings are applied before the client gets out of bed. Otherwise, the legs can swell from sitting or standing. Question 71. The nursing assistant is aware that the purpose of the elastic stockings is to A. Prevent blood clots, B. Hold dressings in place, C. Reduce swelling after injury, D. Prevent pressure sores. The correct answer is prevent blood clots. Elastic stockings exert pressure on the veins. The pressure promotes venous blood flow to the heart. By doing so, the stockings prevent blood clots. Question 72. A COPD client recently admitted to the floor needs constant oxygen therapy. When assisting this patient, the nursing assistant can A. Turn the oxygen on and off, B. Start the oxygen, C. Decide what device to use, D. Keep the connecting tubing secure and free of kinks. The correct answer is keep the connecting tubing secure and free of kinks. The job of the nursing assistant is to make sure there are no kinks in the tubing and to secure the connecting tubing in place. Question 73. After applying an elastic bandage to a client's right leg, you need to check the color and temperature of the leg, A. Every 15 minutes, B. Every hour, C. Every 2 hours, D. Every shift. The correct answer is every hour. In applying elastic bandage, expose fingers or toes to allow circulation checks. Check the color and temperature of the extremity every hour. Question 74. Which of the following statements is correct pertaining to binders application? A. A breast binder can be applied for breastfeeding mothers to relieve discomfort. B. A straight abdominal binders are applied when the client is sitting on a chair. C. The double T binder is specifically used for male clients. D. When securing a straight abdominal binder, help the client in a side-lying position to close it at the back using safety pins. The correct answer is the double T binder is specifically used for male clients. The double T binder is for men, while the single T binder is for women. Question 75. Protective devices are often used to prevent and treat pressure ulcers and skin breakdown. Which of the following devices is least likely used for this particular purpose? A. Trochanter rolls, B. A rubber sheet, C. Bed cradle, D. A flotation pads. The correct answer is rubber sheet. A rubber sheet can predispose the client to develop skin breakdown and pressure ulcers because it creates moisture and friction to the skin. Question 76. Clients requiring oxygen therapy should be monitored for hypoxia. Early signs for hypoxia include A. Breathing comfortably only when sitting, B. Restlessness, dizziness, and disorientation, C. Cyanosis and increased pulse rate, D. Increased temperature and decreased respiratory rate. The correct answer is restlessness, dizziness, and disorientation. Hypoxia means that the cells do not have enough oxygen. The brain is very sensitive to inadequate oxygen. Restlessness is an early sign. Question 77. An asthmatic client can be relieved from dyspnea when he is placed in orthopneic position. This can be done by A. Placing the head of bed in 90 degrees angle, B. Sitting up and leaning over a table with a pillow, C. Hyperextending the neck while on high back rest, D. Placing the client on a high back rest using a pillow. The correct answer is sitting up and leaning over a table with a pillow. Clients with difficulty breathing often prefer sitting up and leaning over a table to breathe. This is called orthopneic position. Question 78. Which action is incorrect when flossing the client's teeth? A. Hold the floss between the middle fingers of each hand. B. Make sure you also floss the backside of the very last tooth on the right, left, top, and bottom of the mouth. C. Move the floss gently up and down between the teeth. D. Use a new piece of floss for each tooth. The correct answer is use a new piece of floss for each tooth. It is unnecessary to use a new piece of floss for each tooth. Break off an 18-inch piece of floss from the dispenser. This will do for all the teeth. Question 79. To obtain a 24-hour urine specimen, the nurse assistant should A. Collect each voiding in separate containers for the next 24 hours. B. Discard the first voided specimen and then collect the total volume of each voiding in 24 hours. C. For the next 24 hours, retain a 30 milliliters specimen of each voiding after recording the amount voided. D. Keep a record of the time and amount of each voiding for 24 hours. The correct answer is discard the first voided specimen and then collect the total volume of each voiding in 24 hours. A 24-hour urine specimen is a collection of all urine by a client over a 24-hour period. It is necessary to ask the client to void, and then discard this voided urine. Question 80. A client was fitted with a hearing aid. She understands the proper use and wear of this device correctly when she says that the device is turned on and adjusted to a therapeutic level, B. A preset level, C. Prescribed level, D. Audible level. The correct answer is audible level. The hearing aid should be adjusted to an audible level that the client can tolerate. Question 81. One of your clients just had a stroke and is manifesting receptive aphasia. Clients with receptive aphasia, A. Are unable to speak. B. Have no difficulty in understanding spoken or written language. C. Are not able to express themselves meaningfully through speech. D. Speak very loudly at all times. The correct answer is are not able to express themselves meaningfully through speech. Receptive aphasia is also known as Wernicke's aphasia. Even though they can speak using grammar and syntax, they usually have difficulty expressing themselves meaningfully through speech. Question 82. The nursing assistant is aware that the responsibility for keeping an accurate INO record is part of her duties. If the client is incontinent, how should she document the output? A. Inform the nurse that the client has voided or defecated. B. Do not document at all since it cannot be measured. C. Record on the output side of the INO sheet each time the bed is wet. D. Review the client's intake and record the same amount on the output side of the INO sheet. The correct answer is record on the output side of the INO sheet each time the bed is wet. If the client is incontinent, cannot control bowels and or urine, record this on the output side of the INO sheet each time the bed is wet. Question 83. Which of the following are examples of fluid output that need to be recorded on the INO sheet? A. Urine only. B. Urine and blood loss. C. Urine, blood loss, and excessive perspiration. D. Urine, emesis, blood loss, and excessive perspiration. The correct answer is urine, emesis, blood loss, and excessive perspiration. Fluid output is the sum total of liquids that come out of the body. Output includes emesis, drainage from a wound, loss of blood, and excessive perspiration. Question 84. A client is receiving oxygen therapy via face mask. Which of the following is contraindicated for this client? A. Eating his lunch. B. Use of cotton bedclothes. C. Shaving using an electric razor. D. Talking with visitors. The correct answer is shaving using an electric razor. Use of electric razors or hair dryers while the oxygen is running is not allowed due to risk of explosion. Question 85. Use of which of the following articles or types of clothing would help a client with osteoarthritis perform activities of daily living adequately? A. Zippered clothing. B. Tied shoes to promote stability. C. Velcro clothing, slip-on shoes, and rubber grippers. D. Button clothing, slip-on shoes, and rubber grippers. The correct answer is Velcro clothing, slip-on shoes, and rubber grippers. Velcro clothing, slip-on shoes, and rubber grippers make it easier for the client to dress and grip objects. Question 86. Which of the following is not included in the care of clients with a pacemaker? A. The client is not allowed to be around electrical appliances. B. The client can operate a microwave. C. The client should avoid magnetic wands in airports. D. Cellular phone use should be monitored closely. The correct answer is the client is not allowed to be around electrical appliances. Clients with a pacemaker can use electrical appliances. Microwaves are allowed. Question 87. Your client has had a bowel movement. The stool is black in color and has a tarry consistency. What is your next action? A. Ask the client what her previous meal contained. B. Task the nurse to observe the stool. C. Dispose of the stool and report the color to the nurse. D. Ask a coworker if this is normal for this client. The correct answer is ask the nurse to observe the stool. The nurse aide should report to the nurse any abnormal stools. Carefully observe the color, amount, consistency, and odor. Question 88. Which is not a rule for collecting specimens? A. Follow the rules of medical asepsis. B. Use the correct container. C. Label the container accurately. D. Collect the specimen when you have time. The correct answer is collect the specimen when you have time. Collecting the specimen at the convenience of the nursing assistant is not a rule to follow. It should be collected at the correct time. Question 89. A nursing assistant will be changing the soiled bed linens of a client with a draining pressure ulcer. Which of the following protective equipment should the nursing assistant wear? A. Mask. B. Clean gloves. C. Sterile gloves. D. Shoe protectors. The correct answer is clean gloves. Clean gloves protect the hands and wrists from microorganisms in the linens. Sterile gloves are not needed for linens. Question 90. A client has an indwelling urinary catheter, and urine is leaking from a hole in the collection bag. Which of the following actions would be most appropriate? A. Cover the hole with tape. B. Report to the nurse immediately. C. Disconnect the drainage bag from the catheter and replace it with a new bag. D. Place a towel under the bag to prevent spillage of urine on the floor, which could cause the client to slip and fall. The correct answer is report to the nurse immediately. The system is no longer a closed system and bacteria might have been introduced. The nursing assistant should report to the nurse immediately. Question 91. Which of the following methods should be used to collect a specimen for urine culture? A. Have the client void in a clean container. B. Clean the foreskin of the penis of uncircumcised men before specimen collection. C. Have the client void into a urinal, and then pour the urine into the specimen container. D. Have the client begin the stream of urine in the toilet and catch the urine in a sterile container midstream. The correct answer is have the client begin the stream of urine in the toilet and catch the urine in a sterile container midstream. Catching urine midstream reduces the amount of contamination by microorganisms at the meatus. Question 92. The nursing assistant is correctly providing penile hygiene to an unconscious client if she A. Uses warm water without soap. B. Dries all areas of the penis thoroughly. C. Washes from the base of the shaft to the tip. D. Avoids retracting the foreskin if not circumcised. The correct answer is dries all areas of the penis thoroughly. Careful drying is essential to avoid maceration of the penis. To decrease the risk for infection, wash the penis from the tip to the base. Question 93. A nursing assistant must obtain the blood pressure of a client in airborne isolation. Which of the following methods is best to prevent transmission of infection to other clients by the equipment? A. Dispose of the equipment after each use. B. Wear gloves while handling the equipment. C. Use only the equipment with other clients in airborne isolation. D. Leave the equipment in the room for use only with that client. The correct answer is leave the equipment in the room for use only with that client. Leaving equipment in the room is appropriate to avoid organism transmission by inanimate objects. Question 94. To prevent circulatory impairment in an arm when applying an elastic bandage, which of the following methods is best? A. Wrap the bandage around the arm loosely. B. Apply the bandage while stretching it slightly. C. Apply heavy pressure with each turn of the bandage. D. Start applying the bandage at the upper arm and work toward the lower arm. The correct answer is apply the bandage while stretching it slightly. Stretching the bandage slightly maintains uniform tension on the bandage. Question 95. The following information is recorded on an intake and output record: milk 180 milliliters, orange juice 60 milliliters, 1 serving scrambled eggs, 1 slice toast, 1 can ensure oral nutritional supplement, 240 milliliters, 50 milliliters water after twice daily medications. What is the client's total intake? A. 530 milliliters. B. 550 milliliters. C. 580 milliliters. D. 590 milliliters. The correct answer is 530 milliliters. 180 plus 60 plus 240 plus 50 equals 530 milliliters. Question 96. While putting an elderly client with an indwelling urinary catheter in bed, a nursing assistant notices the tubing hanging below the bed. She places the tubing in a loop on the bed with the client. Which of the following rationales explains the nursing assistant's action? A. To inhibit drainage. B. To allow drainage to occur. C. To allow the urine to collect in the tubing. D. To have the client check the tubing for urine. The correct answer is to allow drainage to occur. Catheter tubing shouldn't be allowed to develop dependent loops or kinks because this inhibits proper drainage by requiring the urine to travel against gravity. Question 97. A client is placed on suicide precautions. Which of the following tasks would you anticipate the licensed nurse will delegate to you in ensuring the client's safety? A. Don't allow him to leave his room. B. Remove all sharp and cutting objects. C. Give him the opportunity to ventilate his feelings. D. Stay with him at all times. The correct answer is stay with him at all times. Clients on suicide precautions need constant observation by a staff member. Question 98. A client who has Alzheimer's disease is told by the nurse assistant to brush his teeth. He shouts angrily, "Tomato soup." Which of the following actions by the nurse assistant would be correct? A. Of focusing on the emotional reaction. B. Clarifying the meaning of his statement. C. Giving him step-by-step directions. D. Doing the procedure for him. The correct answer is giving him step-by-step directions. The client is experiencing an inability to recognize or name objects, agnosia, and needs single-step instructions. Question 99. When the nursing assistant identifies a client who has attempted to commit suicide, the nursing assistant should A. Call a priest. B. Counsel the client. C. Report immediately to the nurse. D. Refer the matter to the police. The correct answer is report immediately to the nurse. By doing this, the nursing assistant is ensuring the safety of the client. Question 100. A divorced 33-year-old former drug addict is paralyzed from the waist down. How might you assist him in meeting his needs as they related to roles and relationships? A. Have get well cards sent anonymously. B. Provide paper and pen for letter writing to his sons. C. Spend time with him after work hours. D. Leave him alone to allow for meditation. The correct answer is provide paper and pen for letter writing to his sons. The nursing aide can provide assistance by providing paper and pen for letter writing to his sons. Question 101. Clients and families have the right to receive care that is A. Determined necessary by the health team. B. Culturally acceptable to them. C. Dictated as appropriate by medical research. D. Technologically advanced and inexpensive. The correct answer is culturally acceptable to them. Clients and families are unique individuals. You must respect and accept the person's culture. Question 102. When caring for a dying client, the nurse aide should perform which of the following activities? A. Encourage the client to reach optimal death. B. Assist the client to perform activities of daily living. C. Assist client towards a peaceful death. D. Motivate client to gain independence. The correct answer is assist client towards a peaceful death. Major goals for dying clients include maintaining physiologic and psychological comfort and achieving a dignified and peaceful death. Question 103. When a terminally ill client assumes artificial cheerfulness and refuses to believe that loss is happening, what stage of grieving is he in? A. Bargaining. B. Acceptance. C. A denial. D. Depression. The correct answer is denial. The client is in the stage of denial, the first stage of grieving, when he demonstrates artificial cheerfulness. Question 104. As you assist a Hispanic client during her mealtime, which food selections do you expect to be incorporated into a diet that would represent culturally sensitive care? A. Beans and tortillas. B. Cheese and olive oils. C. Vegetables and rice. D. Red meat and potatoes. The correct answer is beans and tortillas. Food preferences for Hispanic clients often include beans and tortillas. Question 105. Which of the following techniques would you use when interviewing a 94-year-old patient? A. Using a low-pitched voice. B. Enunciating each word slowly. C. Varying voice intonations. D. Reinforcing the words with pictures. The correct answer is using a low-pitched voice. Elderly persons are sensitive to sound and can hear normally. By using a low-pitched voice, you will be able to convey your messages clearly. Question 106. A 69-year-old client has been diagnosed with colon cancer. Upon request, information was withheld from her. The client asks you a question about her diagnosis. What will be your response? A. I'm sorry, I don't know. B. I'm sure it's nothing to worry about. You look fine to me. C. I don't have any information as of the moment, but I'll find out for you. D. You need to ask your doctor about that, not me. The correct answer is I don't have any information as of the moment, but I'll find out for you. It is best not to lie to the client. Tell the client you will find her an answer. Then call and talk to your supervisor. Question 107. A client in the long-term facility tells the nursing assistant, I am too depressed to talk to you. Leave me alone. Which of the following response by the nursing assistant is most therapeutic? A. I'll be back in an hour. B. Why are you so depressed? C. I'll sit with you for a moment. D. Call me when you feel like talking to me. The correct answer is I'll sit with you for a moment. Do not heed to the demand of the client that he does not want you around. Use silence and active listening. Question 108. A client says to you, I am a worthless person, I should be dead. What is the best response that you, the nursing assistant, can make? A. Don't say you are worthless, you are not a worthless person. B. We are going to help you with your feelings. C. What makes you feel you're worthless? D. What you say is not true. The correct answer is what makes you feel you're worthless. Talking about these feelings can be beneficial. Initially, the nursing assistant encourages clients to describe in detail how they are feeling. Question 109. A client with a hearing impairment is admitted to a busy hospital unit. Which intervention is most appropriate to meet the client's needs while preventing sensory overload? A. Allow all the client's family members to stay with the client. B. Have conversation at the bedside directed to the client. C. Keep the television or radio on for the client continuously. D. Keep the overhead light on at all times. The correct answer is have conversation at the bedside directed to the client. Having the conversation directed to the client meets the client's needs while creating less disturbances. Question 110. Legally, client's charts are A. Owned by the government since it is a legal document. B. Owned by the doctor in charge and should be kept from the administrator for whatever reason. C. Owned by the hospital and should not be given to anyone who requests it other than the doctor in charge. D. Owned by the client and should be given by the nurse to the client as requested. The correct answer is owned by the hospital and should not be given to anyone who requests it other than the doctor in charge. A client's chart is the property of the facility. Clients do not have the right to see the chart on demand or remove anything from the chart. Question 111. The nursing assistant assigned to obtain vital signs for a group of residents omits taking the vital signs of one of the residents. When the nurse inquires, the nursing assistant admits to forgetting. This is an example of which of the following? A. Accountability. B. Flexibility. C. Dependability. D. Respectability. The correct answer is accountability. This is an example of accountability, even when admitting that you did not properly carry out your duties. Question 112. Monique stopped working as a nursing assistant when she gave birth to her daughter. After 2 years, she decides to go back to work. What are the requirements? A. Enroll in a refresher course. B. Undergo a retraining and a new competency evaluation. C. Competency evaluation only. D. No other requirements are required. The correct answer is undergo a retraining and a new competency evaluation. Retraining and a new competency evaluation program are required for nursing assistants who have not worked for 2 consecutive years. Question 113. It's a busy day in the ward and the nurse on duty hands you a tube of terramycin ointment and gives you instructions to apply it to a patient's eyes. How would you respond to this? A. Task the nurse to demonstrate it to you. B. Follow the nurse's request and apply the ointment. C. Task the nurse to be with you during the application. D. Politely refuse the nurse's request and explain your job limitations. The correct answer is politely refuse the nurse's request and explain your job limitations. Limitations often include giving medications, includes applying prescription skin creams, lotions, or ointments. Question 114. During a nursing assistant's orientation to the home facility, the nurse supervisor emphasizes effective communication. To communicate, the nursing assistant should do all of the following except A. Use terms with many meanings. B. Be brief and concise. C. Present information logically and in sequence. D. Give facts and be specific. The correct answer is use terms with many meanings. For good communication, the nurse aide should use words that mean the same thing to the sender and the receiver. Question 115. A nursing assistant answers an incoming phone call only to find out that the caller was calling a different unit. How should the nursing assistant facilitate the call transfer? A. Ask the caller what telephone number he is trying to reach. B. Task the caller to please hold, then go back to unfinished tasks. C. Or refer the call to the nurse on duty. D. Tell the caller that you are going to transfer the call and give the phone number in case the call gets disconnected. The correct answer is tell the caller that you are going to transfer the call and give the phone number in case the call gets disconnected. In transferring a call, first find out who is calling and transfer calls only if appropriate. Give the number in case of disconnection. Question 116. A nursing assistant is in the process of giving a client a bed bath. The unit secretary calls on the intercom to relay that there is an emergency phone call. The appropriate action is to A. Immediately walk out of the client's room and answer the phone call. B. Cover the client, place the call light within reach, and answer the phone call. C. Finish the bed bath before answering the phone call. D. Leave the client's door open so the client can be monitored and answer the phone call. The correct answer is cover the client, place the call light within reach, and answer the phone call. To maintain privacy and safety, the nurse aide covers the client and places the call light within the client's reach. Question 117. The nursing assistant assigned to the medical ward receives a new client for the shift. She wants to know about the case and the kind of nursing care already done. The nursing assistant reads the A. Flow sheet, B. Cardex, C. Progress notes, D. Nursing discharge summary. The correct answer is Cardex. The Cardex is a widely used, concise method of organizing and recording data about a client, making information quickly accessible. Question 118. On nursing rounds, a client is found lying on the floor. Which statement would be most appropriate for the nurse aide to record in the client's medical record? A. It is most likely that the client attempted to climb over the side rails and fell. B. Upon entering the room, the client was found lying on the floor. C. The client had been restless all evening and was trying to get out of bed. D. The presence of a bed alarm could have prevented the fall. The correct answer is upon entering the room, the client was found lying on the floor. The nurse aide should document only the facts of the situation. Question 119. Which action by a nurse aide could jeopardize the confidentiality of computerized medical records available at a nurse's station? A. Log out and sign off all computer screens before leaving a terminal. B. Share passwords for computer access with colleagues who have forgotten their own passwords. C. Periodically change computer access passwords. D. Prevent an unidentified healthcare worker from viewing computer records. The correct answer is share passwords for computer access with colleagues who have forgotten their own passwords. The nurse aide should never share computer access passwords with other colleagues. Question 120. A registered nurse is orienting a newly certified nursing assistant to the unit. In communicating with culturally diverse clients who speak a different language, the nursing assistant should A. Speak loudly and slowly. B. Stand close to the client and speak slowly. C. Use an interpreter to speak to the client. D. Speak to the client and family together to increase the chances that the topic will be understood. The correct answer is use an interpreter to speak to the client. Having an interpreter present during the communication is the best method to be practiced. Question 121. Which of the following actions is correct when giving a client a bath? A. Clean the perineal area by gently wiping with the washcloth from back to front. B. Ensure any areas not being currently washed are covered by a sheet or towel. C. Make the client give themselves their own bath, even if they perform it poorly. D. Lotion the client's feet after bathing and be sure to get in between the toes. The correct answer is ensure any areas not being currently washed are covered by a sheet or towel. In order to maintain privacy and keep a client warm, it is important to cover areas that are not being bathed. Question 122. Which of the following procedures cannot be performed by a nursing assistant? A. Reporting a soiled dressing to the nurse. B. Inserting a Foley catheter. C. Performing oral care on an unconscious patient. D. Assisting the client to the bathroom. The correct answer is inserting a Foley catheter. Inserting an indwelling urinary catheter requires sterile technique, which is not a component of nursing assistant skills. Question 123. A client who suffered a left-sided stroke 1 year ago has unresolved aphasia. The nurse knows that the term aphasia means A. That the client is confused, B. That the client is unable to void, C. That the client is unable to understand and process language, D. That the client is unable to speak. The correct answer is that the client is unable to speak. The term aphasia means that the client is unable to speak, or may have difficulty finding words at times. Question 124. A patient who is immobile may experience which of the following feelings? A. Confusion. B. Laziness. C. Happiness. D. Sadness. The correct answer is sadness. This patient may feel sad due to the limitation of their illness. Question 125. The Omnibus Budget and Reconciliation Act, OBRA, requires all nursing homes to do what for their clients? A. Help residents write wills and choose power of attorneys. B. Help residents reach their highest level of psychological and mental functioning. C. Help residents perform ADLS and avoid neglect. D. Help residents to transfer to other nursing homes if they want. The correct answer is help residents reach their highest level of psychological and mental functioning. OBRA requires facilities to help their residents achieve their highest points of physical, psychological, and mental functioning. Question 126. Range of motion exercises are most important for which type of patient to perform? A. A patient with a pulled leg muscle. B. The patient who has hypertension. C. The patient with hemiplegia. D. A patient with depression. The correct answer is a patient with hemiplegia. The patient with hemiplegia should participate in range of motion exercises in order to maintain joint function and avoid blood clots. Question 127. Which of the following is an example of a nursing assistant's desired characteristic of reliability? A. The nursing assistant lets the nurse know when a patient states he is in pain. B. The nursing assistant monitors a patient's vital signs. C. The nursing assistant completes a task designated by the nurse in a timely manner. D. The nursing assistant clocks in 15 minutes after her shift began. The correct answer is the nursing assistant completes a task designated by the nurse in a timely manner. Completing tasks as asked indicates reliability. Question 128. The term grievance refers to which aspect included in the Patient Bill of Rights? A. There is no lifetime monetary limit on essential care. B. Patients are not allowed to call doctors at home. C. Patients have access to their health information at all times. D. Patients have the right to file a complaint without fear or penalty. The correct answer is patients have the right to file a complaint without fear or penalty. The ability to file a grievance in a nursing home or other nursing care facility is considered a legal right. Question 129. Which of the following diseases does not require airborne precautions? A. Measles. B. MRSA. C. Tuberculosis. D. Chickenpox. The correct answer is MRSA. MRSA is a disease transmitted by skin-to-skin contact. It does not require airborne or droplet precautions. Question 130. The nursing assistant cares for a patient with hepatitis C. The nursing assistant knows that the patient could have come in contact with this disease in which of the following ways? A. For drug use. B. Dirty toilet seat. C. Dirty eating utensils. D. Going barefoot. The correct answer is for drug use. For drug use is one of the many ways that it is possible to contract the hepatitis C virus. Question 131. The nursing assistant cares for a client who is depressed. One day, the client states, "I can't go on any longer. I have made a plan to kill myself." Which of the following is the correct action? A. Report the situation to the physician. B. Ask the patient, "Can you tell me more about your feelings?" C. Report the situation to the nurse in charge. D. Reassure the patient by saying, "It's not that bad. You'll feel better tomorrow." The correct answer is report the situation to the nurse in charge. This patient is no longer just depressed, they are suicidal. Having a plan puts them at increased risk. Question 132. When recording data on a legal form, it is considered correct to write with which of the following? A. A black or a blue pen. B. A blue pen. C. A black pen. D. The red pen. The correct answer is a black or a blue pen. Legal documentation must be composed with a black or a blue pen in order to be valid. Question 133. The nursing assistant takes the blood pressure of a patient known for running low. To her surprise, the reading is 155/85. Which of the following factors might be directly responsible? A. The patient denies skipping any medication. B. The patient is stressed. C. The blood pressure cuff is too tight. D. The patient is lying in bed. The correct answer is the blood pressure cuff is too tight. The blood pressure cuff size is a direct influence on the reading. The blood pressure will read higher with a tight cuff. Question 134. What is the difference between Sims position and left lateral position? A. In Sims position, a pillow is placed between the patient's knees to prevent them from touching. B. In lateral position, the patient's head is elevated to 15 degrees on two pillows. C. In lateral position, the patient's undermost arm is positioned laterally and parallel to the patient's back. D. In Sims position, the patient's undermost arm is positioned laterally and parallel to the patient's back. The correct answer is in Sims position, the patient's undermost arm is positioned laterally and parallel to the patient's back. This correctly describes how Sims position is different than left lateral position. Question 135. When assisting the resident to transfer from the bed to a chair, the nursing assistant knows it is necessary to do all of the following except: A. Assist the resident to put on a robe and non-skid slippers. B. Encourage the resident to pivot themselves with minimal assistance. C. Place the chair on the resident's strong side. D. Place the bed in the lowest position and lock the wheels. The correct answer is encourage the resident to pivot themselves with minimal assistance. Residents should be fully assisted and supervised when turning in order to prevent falls. Question 136. When applying a jacket restraint to a patient, it is most important to A. Check that the patient is not able to hit any other patients nearby. B. Check that the patient can fully expand their chest for breathing. C. Use a half-bow knot to secure each tie around the bed frame. D. Use a square knot to fasten the vest ties together behind the chair. The correct answer is check that the patient can fully expand their chest for breathing. Breathing is always priority number 1 for patients. After that, concentrate on how to apply the vest properly. Question 137. Choose the observation that should be reported to the nurse stat. A. A temperature of 98.9 degrees Fahrenheit. B. A pulse of 72. C. A 32 respirations per minute. D. A blood pressure of 102/75. The correct answer is 32 respirations per minute. The number of respirations is slightly too fast to be considered normal and could be considered a respiratory problem. Question 138. Which of the following best describes the concept of empathy? A. A nursing assistant asks a patient whether they would like to take a walk or watch a movie. B. A nursing assistant speaks with a dietitian about alterations to the patient's meal tray. C. A nursing assistant speaks with a patient about their recent diagnosis of cancer. D. A nursing assistant asks the nurse when she may take a meal break. The correct answer is A nursing assistant speaks with a patient about their recent diagnosis of cancer. Speaking with a patient about a recent, potentially devastating diagnosis shows a willingness to discuss feelings and issues. Question 139. Another term that is similar to the word convulsion is A tremors, B a seizure, C a fever, D hypertension. The correct answer is seizure. Convulsions are also sometimes known as seizures. Question 140. Which of the following bedtime snacks should a patient choose in order to increase their intake of vitamin D? A. Some pretzels. B. A cookie. C. An apple. D. A warm glass of milk. The correct answer is a warm glass of milk. Milk and other dairy products are usually fortified with vitamin D. This is the best snack to increase intake. Question 141. Diabetes is a disease of which primary body system? A. Respiratory. B. Musculoskeletal. C. Endocrine. D. Cardiac. The correct answer is endocrine. Diabetes is a disease process that occurs due to a disease of the endocrine system and subsequently affects all other systems. Question 142. Which of the following is the leading cause of accidental death in those 85 years of age and older? A. Poisoning. B. Falls. C. Car accidents. D. Drowning. The correct answer is falls. Falls are the number one cause of accidental death in this age group. Work hard to prevent them. Question 143. All of the following factors may interfere with elimination except A. Infection, B. Aging, C. Medications, D. Family stress. The correct answer is family stress. Family stress does not typically interfere with elimination. Aging, medications, and infection do have a direct effect on elimination. Question 144. During a bath, the three most important things for the resident are A. is safety, security, and privacy. B. is safety, warmth, and cleanliness. C. comfort, rest, and security. D. privacy, rest, and warmth. The correct answer is safety, security, and privacy. Safety, security, and privacy are most important to the resident during a bed bath. Question 145. A nursing assistant arrives at work. 3 hours into the shift, she feels chilled and takes her temperature. The readout is 101.0 degrees Fahrenheit. The correct action is to A. continue working, but wear a mask. B. report herself to the nursing supervisor and be dismissed home. C. continue working, but wash hands every 15 minutes. D. leave immediately for home. The correct answer is report herself to the nursing supervisor and be dismissed home. A fever means that you are an infection risk to residents. The nursing supervisor can assist with transferring care. Question 146. A nursing assistant happens to witness a patient fall and is asked to document what happened. Which of the following statements is written correctly for legal documentation? A. The patient tripped over bedsheets because housekeeping left them on the floor all day. B. The patient slipped and slid down the side of the bed to the floor, landing on their sacrum. C. The patient fell because they ignored me when I told them to stay in bed. D. The patient fell because the nurse forgot to lock the wheels of the bed again. The correct answer is a patient slipped and slid down the side of the bed to the floor, landing on their sacrum. This statement is the only correct documentation because it reflects events as they happened and does not assign blame. Question 147. Which of the following disorders are said to be irreversible? A. Chickenpox. B. Asthma. C. Emphysema. D. Hypertension. The correct answer is emphysema. Emphysema is the only truly irreversible disease listed. Asthma may be outgrown, and hypertension may be cured with lifestyle changes. Question 148. The abbreviation RX indicates A. A type of wound, B. A treatment, C. An acute illness, D. A disease. The correct answer is a treatment. The abbreviation RX stands for treatment or prescription. Question 149. The nursing assistant cares for a diabetic client. Which of the following symptoms in this client should be immediately reported? A. Emesis. B. Refusal to eat dessert. C. A cough. D. A bowel movement. The correct answer is emesis. Emesis, vomiting, in the diabetic client can indicate a potential for blood sugar imbalance. Question 150. It would be inappropriate to utilize an alcohol-based hand sanitizer in which of the following situations? A. The nursing assistant's hands are visibly soiled. B. The nursing assistant has just left the patient's room. C. The nursing assistant is about to enter the patient's room. D. The nursing assistant helps a patient to the bathroom while wearing gloves. The correct answer is the nursing assistant's hands are visibly soiled. Visibly soiled hands require scrubbing, soap, and water to clean. Question 151. The nursing assistant knows that urine is normally A. Dark in color and foul-smelling, B. Dark yellow, C. Clear, dark yellow, D. Clear, pale yellow. The correct answer is clear, pale yellow. Clear, pale yellow urine indicates a well-hydrated patient. Question 152. The nursing assistant is helping a male patient to use the urinal. She pulls the curtain around the bed for privacy before saying, Aide, if you do not fill it completely, I will empty it later. B. If you need any more assistance, please ring the bell. C. Please ring me when you are finished and I will empty it for you. D. Please let me know later how many ml. The correct answer is please ring me when you are finished and I will empty it for you. The nursing assistant cannot ask the patient to measure his own urine, or delay in emptying it. Question 153. A patient is undergoing bowel training. The nursing assistant knows that bowel training, Aide, is used for people with colostomies to ensure a regular pattern. B. Is a normal part of a healthy digestive tract. C. Is a technique for going to the bathroom without pushing. D. Is not used anymore. The correct answer is used for people with colostomies to ensure a regular pattern. Bowel training is used with ostomy patients to ensure a regular elimination pattern. Question 154. The nursing assistant would suspect that one of her patients is having a problem with swallowing if she notices which of the following? A. Completing a meal over the course of 15 minutes. B. Chewing very slowly. C. Pocketing of food. D. Uneven chewing. The correct answer is pocketing of food. A patient who pockets food may be having a difficult time swallowing. Question 155. When caring for a patient, the nursing assistant notices that the patient is bleeding around in foresight. Which of the following is the most appropriate action to take? A. Clamp the forecatheter and tell the nurse. B. Tell the nurse when she happens to see her. C. Report it to the patient's nurse immediately. D. Report it to the nursing supervisor. The correct answer is report it to the patient's nurse immediately. This should be reported to the patient's nurse immediately. Question 156. Rectal temperatures are usually taken on patients who are A. Combative, B. Unconscious, C. Anxious, D. Confused. The correct answer is unconscious. Unconscious patients cannot close their mouths around an oral thermometer. Question 157. A typical blood pressure around the upper arm should not be taken when the patient A. complains that this is the fifth time today, B. has 4 catheters in both the left and right arms, C. has heart failure, D. has had lymph nodes removed around the axilla of the left arm. The correct answer is has 4 catheters in both the left and right arms. If the patient has 4 catheters in both arms, a blood pressure cuff will impede their intravenous flow. Question 158. Which of the following is an example of nonverbal communication? A. Hand gestures, B. A whisper, C. Mouthing words, D. Minimizing facial expression. The correct answer is hand gestures. Hand gestures are an example of nonverbal communication. Question 159. Which of the following is an example of emotional lability? A. The patient gets upset after a long day and blames it on tiredness. B. The patient gets upset when he learns he has been diagnosed with cancer. C. The patient gets upset when he does not receive a plate in his favorite color. D. The patient gets upset after telling the nurse immediately prior how happy he is. The correct answer is the patient gets upset after telling the nurse immediately prior how happy he is. Switching quickly from happy to sad, or mad to peaceful, is the definition of emotional lability. Question 160. The nursing assistant speaks with the nursing facility's ombudsman. The role of this position is to A. care for patients as if they were their own family, B. make residents as happy as possible, C. assist residents to set up insurance and policy claims, D. investigate residents' complaints and bring them to the attention of the correct authorities. The correct answer is investigate residents' complaints and bring them to the attention of the correct authorities. The ombudsman's job is to ensure that residents' complaints are heard. Question 161. An 85-year-old resident at a long-term care facility is signing up for an afternoon activity. Which of the following should the nursing assistant suggest? A. Gardening, B. Tai Chi and meditation, C. Basketball, D. Watching TV. The correct answer is Tai Chi and meditation. Tai Chi is excellent for balance and would help the patient to decrease her risk of falls. Question 162. The nursing assistant knows that the term pulse deficit refers to A. the difference between the systolic and diastolic blood pressure, B. an absence of the pulse, C. the difference between the apical and radial pulse, D. a strong pulse. The correct answer is the difference between the apical and radial pulse. The difference between the two pulse rates, apical and radial, is called the pulse deficit. Question 163. A nursing assistant watches a nurse teach a client about heart failure. The client has many questions and seems more confused rather than less. Which of the following strategies is best in regard to teaching? A. Give the client a DVD to watch about heart failure. B. Have the client repeat back what the nurse has said. C. Give the client a brochure about heart failure. D. Encourage the client to form more of a discussion with the nurse in order to understand better. The correct answer is encourage the client to form more of a discussion with the nurse in order to understand better. The more involved a client is in learning, the more they will remember and understand. Question 164. The nursing assistant cares for a client with AIDS. The nursing assistant knows that AIDS patients require what type of precautions? A. A droplet, B. Contact, C. Respiratory, D. Standard. The correct answer is standard. AIDS patients require standard precautions. Gloves must be worn at all times when handling blood or other body fluids. Question 165. When the nursing assistant brings the client his tray for lunch, the client repeats questions twice before remembering the answer. The nursing assistant knows that the client had a fall 2 days ago. Which of the following actions is correct? A. Assess the client's head for bruising. B. Take the client's temperature. C. Report it to the nurse immediately. D. Assume the client is forgetful. The correct answer is report it to the nurse immediately. Memory loss after a fall can indicate a concussion. Report it to the nurse immediately. Question 166. A resident is having difficulty chewing regular meals at dinner. Which of the following diets might be suggested to order for next time? A. Soft. B. Liquid. C. Pureed. D. Hard. The correct answer is soft. A soft diet should be tried before a pureed diet for this patient. Question 167. A patient says that her visitor is unable to come during visitor hours and asks if she could be accommodated. The nursing assistant, A. reviews the issue with the patient's nurse before answering. B. says, of course, that would be fine. C. reviews the issue with the charge nurse before answering. D. says, I'm sorry, that's not our policy here. The correct answer is reviews the issue with the charge nurse before answering. It is appropriate to review this with the charge nurse of the unit before answering yes or no. Question 168. Before assisting the nurse to administer an enema to a bedridden client, the nursing assistant should most importantly, A. review the procedure and what's going to happen. B. Open the window. C. Reassure the client that it won't hurt much. D. Gather all materials needed. The correct answer is review the procedure and what's going to happen. It is important for the resident to know what's going to happen and what to expect. Question 169. When making the patient's bed, the nursing assistant knows it is most important to A. Change the pillow cover every 4 hours. B. Use linen that has only been in the client's room. C. Inspect the sheets for softness. D. Straighten the sheets to reduce wrinkle formation. The correct answer is straighten the sheets to reduce wrinkle formation. Wrinkles and creases in the sheets can contribute to bed sores. Question 170. Rehabilitation care after any injury should begin when? A. When the patient enters a rehab program. B. 1 week into recovery. C. As soon as possible. D. When the doctor says so. The correct answer is as soon as possible. Rehabilitation should begin as soon as possible in order to get the most recovery. Question 171. A nursing assistant who suspects a resident is being abused by someone in the facility should report it to A. the charge nurse. B. the nurse caring for the client. C. the fellow nurse's aide. D. the CEO. The correct answer is the charge nurse. Reporting it to the charge nurse will ensure that it is handled properly. Question 172. A nursing assistant cares for a resident who has a cast on the left arm. While receiving a bed bath, the nursing assistant notices that the fingers on the client's left hand are cold. Which of the following actions should the nursing assistant take next? A. Tell the nurse immediately. B. Feel the client's fingers on the other hand. C. Ask the client if it hurts. D. Give the client gloves. The correct answer is feel the client's fingers on the other hand. First, check the fingers on the other hand. The client may have overall decreased circulation. If the fingers on the other hand are warm, however, the cast may need to be adjusted. Question 173. A client in the hospital announces that he is leaving this minute and that no one can stop him. The nursing assistant should A. Tell the patient to wait and see if he likes the care more as he feels better. B. Tell the patient to wait so that she can get the nurse because he has to sign a form. C. Warn the patient that it's better to follow the doctor's recommendations. D. Tell the patient that he can't leave. The correct answer is tell the patient to wait so that she can get the nurse because he has to sign a form. Clients who want to leave AMA against medical advice may do so, but they need to sign an AMA form. Question 174. A patient with a respiratory illness complains of thick, sticky secretions that are hard to cough up. The nursing assistant knows to suggest which of the following? A. Drink plenty of fluids. B. Turn and cough every hour. C. Go outside and breathe the fresh air. D. Cough harder. The correct answer is drink plenty of fluids. Drinking fluids will help to lubricate the secretions so that the patient can cough them up easier. Question 175. A patient has a fever and describes feeling very uncomfortable. Which of the following recommendations is best for the nursing assistant to provide? A. Give the patient a back rub. B. Administer Tylenol 500 mg per. C. Give the patient a cool washcloth to be placed on the forehead. D. Suggest the patient sit outside in the fresh air. The correct answer is give the patient a cool washcloth to be placed on the forehead. A cool washcloth can make a patient with a fever feel better. The nursing assistant may not administer medications. Question 176. The nursing assistant overhears the nurse say to the patient that he has a bulging tympanic membrane. What does this most likely mean? A. The patient is in pain. B. The patient has a viral illness. C. The patient has an ear infection. D. The patient should clean his ears more frequently. The correct answer is the patient has an ear infection. The tympanic membrane is more commonly known as the eardrum. A bulging membrane typically indicates an ear infection. Question 177. A patient who has recently been paralyzed below the waist due to a motorcycle accident refuses his medications from the nurse. The patient then refuses to say anything. What is the nursing assistant's best response? A is say, "You seem upset." B. Ignore the client's temper tantrum. C is say, "Why did you refuse your medication?" D. Say, "Don't worry, things will seem better tomorrow." The correct answer is say, "You seem upset." Reflective statements are an important therapeutic tool. Question 178. A 52-year-old homeless man has just been admitted to the ER with a core body temperature of 90.2 degrees Fahrenheit. The nursing assistant knows that the organ most under stress from the low body temperature is the A. Lungs, B. Liver, C. Heart, D. Ears. The correct answer is heart. The heart may fail or go into an arrhythmia from the drop in body temperature. Question 179. The nursing assistant receives her assignment for the shift and notices that she does not have a nurse assigned to her group. What action should she take next? A. Offer to team up with another nursing assistant to give medications. B. Begin gathering medications she must give. C. Loudly complain about the situation. D. Alert the charge nurse to the situation. The correct answer is alert the charge nurse to the situation. Medications may not be given by a nursing assistant. Alert the charge nurse to ensure that there is a nurse provided. Question 180. A nursing assistant begins caring for a client during a bed bath and notes he has a reddened, intact area on his coccyx. Which of the following correctly describes this condition? A. Ulceration stage 1. B. Ulceration stage 2. C. Ulceration stage 3. D. Ulceration stage 4. The correct answer is ulceration stage 1. This is a stage 1 ulceration, or bed sore, and should be reported to the nurse.